Welcome, my friends, to the Bob and Brad podcast, produced by Bob and Brad, the two most famous physical therapists on the internet. I am Bob, and I'm exactly one half of the Bob and Brad team. Today, I'm going to interview a speech language pathologist. She's certified by the ASHA, which is a speech language pathology organization. She graduated from the University of Central Florida with an MA in 2005, and she's practiced as a medical-based speech language pathologist, primarily with adults in skilled nursing, inpatient and outpatient and home health settings. She's been an active clinician for many years in both developing and presenting multidisciplinary training and CE courses in areas such as dementia and treatment approaches for medically involved cases. So again, welcome our new guest, Betsy Page. And we're going to talk about shortness of breath, which encompasses a lot of things. There is a lot of things that can cause shortness of breath. You want to speak to a few of them?
Well, sure. I mean, it could even be completely outside of the cardiopulmonary. Start over from that. It could be completely outside of the lungs. So say you have issues with hemoglobin, that can cause shortness of breath because the blood is what delivers the oxygen.
My son is a runner and he had low iron, and of course he was a terrific runner, but he was having trouble walking down the hallway when his iron was really low.
Yeah. So I think so often we just go straight to the lungs. It's the lung, but it could also be a cardiac condition.
Right. Absolutely.
So we could be talking about something happening within the lungs, a disease process there. We could be talking about something with the heart and its efficiency to have the delivery system going. We can look at
talking
gas
about
exchange.
Deconditioning after surgery or
absolutely
bedridden.
Yes, surgery, critical illness. So anytime you've been hospitalized, anyone hospitalized, you could be a healthy 20-something and we could put you in the hospital and you would have deconditioning. That's expected. So part of what we can do is when someone's in that position, we can see the weakness in the respiratory muscles and address that. And one nice thing about the breather is you can do this when you're bedridden. Maybe you even had an elective surgery, but you're going to be non-weight bearing for a while.
So what we're talking about is strengthening muscles.
Yeah.
And you're strengthening the muscles as you breathe in, and you're strengthening the muscles as you breathe out. Yes. So it's like weightlifting, like you would do for the rest of your body. You actually have to focus on the specific muscles that are involved in that task.
Yeah, so we want to focus on a nice breathing technique, and we're looking for diaphragmatic breathing in general. We don't want to be using all the muscles up here. We want to be doing that belly breathing and then apply resistance to that so that all those muscles that do that beautiful, efficient ventilation get strengthened during this respiratory muscle training.
Would this fit in with someone who's recovering from COVID or pneumonia or something similar?
That's a great question. So we never recommend use during the acute phase of an illness. And I think that's true in general, right? We're not recovering yet, so we're not into rehab yet. But once we get into recovery, it has been very helpful with cases such as pneumonia or exacerbations of different conditions. So yes, there are even clinicians who use it in the ICU to help wean people from the vent. So still vent dependent. Yeah. COVID is different though. And so COVID can't be lumped into the same category. And I think at this point, that's the thing we know about COVID.
That's all you know.
It's so different. and one person presents very differently from another. So we've been in collaboration with some different really neat professionals that are doing COVID rehab clinics, because we get the question, would this be appropriate with someone post-COVID? And we want to know the right answer. And the answer at this time is there is not one answer.
So it possibly could, but it really is going to be up to your clinician probably at the time.
Yes.
To,
So the things you're looking for is this taxing someone and causing them like a setback in their
Sure.
level of fatigue? Because that's something that's super super difficult for our long haulers, just that fatigue they're dealing with. And very often you'll see where they talk about, okay, I felt good, so I tried to do more this day, and then I was bedridden for a few days. Well, we don't want to introduce anything that's going to have that big of an impact.
It's going to set you back.
Yeah.
Basically.
So it's going to go along with any other kind of exercise. We're going to be real careful with our post-COVID patients. There are some that get on and use the breather like I would expect with a pneumonia recovery. And then there are others that just have a hard time, and we need to back off.
Gotcha. So is there any science that backs the use of the breather? Again, do you mind showing the breather? I don't think people know what we're talking
Sure.
about.
So the medical device, the breather, is blue or pink. This one's marked A. It's my son's. I don't want to use this breather. If you are in a setting where you see multiple patients, I always write their name on it.
Sure.
There's quite a bit of science. The breather's been around since like 1980. So there's a lot, and there's a lot of science in general, not just with the breather, but other respiratory muscle training devices. And obviously we can apply the principles of resistance training in other muscle groups, right? Which is pretty well established. We know if we put weight in someone's hand and have them do upper extremity exercises, we're strength training. We're looking to train resistance. Same thing with our legs or our core. So there's quite a bit of research, and then research in different diagnostic groups. That's one of the things on our blog that I liked. You can go on the science blog and type in you can type in apnea, sleep apnea, and it'll pop up some studies that you can go and investigate.
So this possibly could help with sleep apnea?
Yes, really more in the mild to moderate severities of sleep apnea. It certainly depends on what is causing the apnea, but very often our muscles are not toned, and so it is actually our tissue, our muscles, that are kind of lagging into our airway at night. So it can be very helpful, with the mild and moderate apnea groups. And there's research there, you can go look.
So a lot of the research can be found on your website. I'm going to mention your website right now.
Yeah.
PN, that's Paul Nice, pnmedical.com. Very simple, but loads of information on there. And there's also instructional videos on how to use the breather, correct?
Yes. So I was going to say, I have the great privilege of working with a scientist. I love an interdisciplinary team. Love it. And now I get to work with a scientist, and just that science blog, I go look stuff up and I work for the company. So, yeah.
Yeah, and I want to just mention, we're not talking about a very expensive device here. This is very reasonable. And it, if you are a person with shortness of breath, and especially if you have it diagnosed, and let's say you're having trouble walking your dog or walking down to the mailbox, this can make a big difference. You want to talk about some of the research has shown that how quickly some of this might be able to see some changes?
Yeah, it certainly depends on what's the underlying cause for that. shortness of breath. And the breather's not going to reverse a disease process
Right.
in the lungs. So, but when a person is compromised in any of their systems, so it could be cardiac or pulmonary, neuromuscular, where there's a compromise, those systems need the best support. And so what we're talking about is strengthening the muscles that control breathing. The mechanics of breathing is accomplished by muscles. And so what we're talking about doing is strengthening that. And if you train, so say you train for running, I
Right.
never, but I know people who do. And as they train, running actually becomes easier, right?
Right.
You get more efficient at it. The strength allows you to do more, to go further. We're talking about strengthening in the muscles that control breathing. So we want to make it more efficient for that person to get the gas exchange they need, get rid of the carbon dioxide, get the oxygen in.
Yeah, it was such a strange concept for me to think of breathing that way. I don't know why, but just, the fact that you would strengthen the muscles of the accessory muscles and the
Mm-hmm.
diaphragm, which is a big muscle in itself. And I don't know why. That's just a foreign concept to me. But I think running is a good example. Like a lot of people who run all the time but don't do any strengthening, it can be actually somewhat to the point where you're not strengthening your legs as much as you think you are, because you become so efficient, you're not even using the muscles that you that you want to strengthen. So yeah, even the runner should be doing some strengthening. And the runner could also do using, they actually have we got to mention at least the breather fit, correct? Is that what?
Yes. So we have two devices for people looking to enhance performance, and Breather Fit is for athletes. And it's equivalent, resistance wise, is Breather Voice for people who use their lungs for power for, say, speech,
Sure.
professional speakers, singers, could be wind instrumentalists, performers in general. So it's interesting with athletes, what they're reporting back is increasing their time to fatigue.
Sure.
So they're able to perform athletically more efficiently. And I have a sister who does is a triathlete, and
Sure.
she had an injury, so she wasn't able to train for a few months, which is catastrophic when you're
right. Yes, when you're an athlete like
when
that.
you're an athlete. But what
Yes.
she was so pleased is she kept training with her Breather Fit. And when she got clearance to train again, she couldn't believe her endurance didn't take the hit she expected it to.
Wow.
So certainly her legs needed strengthening and that type of thing, but her endurance, like, she could do it. And she was so pleased with that, because all she could do for a while was basically the breather.
I have to be honest. I didn't hear of the breather until after my son was out of college, and he ran in college. And I was like so disappointed, because I really believe this would have gave him an edge. I mean, just would have increased his performance to some level anyway. So it really would have been fun to check it out and see it firsthand. So,
Yeah.
so with the breather, I want to mention other breathing devices, because people get shortness of breath. I see them in the hospital, they've had surgery. And one thing I see is the incentive spirometer. So how does this compare to that? I mean,
That's a great question. So the incentive spirometer basically is not an exercise device. It doesn't add a workload. And by workload, in the case of the breather, it's resistance. So kind of like lifting weights for the muscles of your lungs. The incentive spirometer doesn't have any workload. It is feedback. So the instructions are to take a big breath and to see how far you can make that ball go up, right? And so you can get some data, you can get some information about the amount of air you can displace on an inhalation, but you're not working those muscles against any kind of workload to strengthen them.
That was really revealing to me because I thought seeing that thing, I don't know why I thought was some resistance, when I saw that.
Yeah,
So
you can take it apart and see there's nothing.
sure. Do you want to show the breather and then how the levels of resistance there is for inhaling and exhaling?
Sure. So this is the breather device, and you have resistance for inhale and resistance for exhale. And those dials can be adjusted independently of one another. So if you have a condition where exhale is a little bit harder for you, and COPD often is this way, you can increase the inhale resistance. So say you're ready to bump up and you're at 3 for inhale, but exhale, you still need to stick at 2. That's totally doable. So we're working both sides of the breath cycle. We're working the entire breath cycle. And we're wanting to strengthen it together, but they don't necessarily have to be at the same setting.
This was developed by a speech language pathologist, correct?
Actually, it was a respiratory therapist,
Oh,
and
that's right. Respiratory
PN
therapy.
Medical, the name of the company, is Peggy Nicholson. So
Oh, I didn't know that.
yeah, in the field, in the hospital, she could see, my patients have these medical conditions, but it's the weakness too. The weakness is exacerbating all these symptoms. And so, needing a way to address it, like a great therapist, she's like, well, I guess I'll invent something.
Quite a few years ago, right?
1980, yes.
Oh, wow.
Yeah.
You probably weren't even born, but
That's the year I was born.
oh my gosh. Yeah, I feel old. So if someone, had shortness of breath, let's say it's diagnosed, can they go to the website, purchase a breather? And I know there's instructional videos there. Do you think they can possibly try this on their own, or is it someone they should have help with? Or I suppose it's dependent on it, right?
It is dependent, but say you were someone at home and you're like, I want to walk the dog and I can't because of the shortness of breath. I wonder if this is something that would help me. Certainly, you could talk to your healthcare provider if you have some kind of diagnosis, and
Sure.
if there are therapists around to help, that type of thing, or trainers. But go to the website, and I would say even just watch the videos in the
Sure.
start here box. Watch them and see what you think. You don't need a prescription to buy a breather, so you can do that straight from the website if you would like to. And then the videos are there for you to use whenever you need them. If having a little bit more coaching would help, there's an app, the Breather Coach app, which will walk you through a session. It will tell you inhale,
The Breather Coach app,
Breather Coach
and
app.
it's free.
It's free.
And what is typically, how much time does it take to use the breather throughout a day? If you have an average person that is having difficulty.
In average, we say about 5 minutes in the morning, 5 minutes in the evening.
So very little time.
Very little time. You're not working to fatigue. Do not work to fatigue. Don't make me come over there.
Sure.
So we're asking for you to work at like a moderate level of effort. You can feel it, but you're not getting out of breath doing this. So the idea is it's also not going to tax your energy for the day. If you have limited air for the day, you have to be aware of that.
And is there a way to monitor your progress?
Yeah.
Is there some suggestions you might make? Even to see how you're doing, to see that you're improving.
Yeah, so if it's someone, in their home thinking about using it for themselves, think about what's important to you. So if it is walking the dog, use that as a gauge. I used to be able to only go, down the street 10 houses and back, and now
Sure.
I'm feeling good enough to go around the block. That doesn't scare me anymore. Or I've had patients who, when they get to the end of the stairs, they would have to stop and catch their breath. Things that stand out to you in your daily life, pay attention to that. There are other simple things you could do as well. Say, like a walk test. How far can you walk in 2 minutes?
Sure.
Does that change? Can I do all of my morning routine now, take a shower and everything. How many times do I have to rest and catch my breath? Those kinds of things. On the speech side, I've had patients who can talk audibly in the morning, but cannot in the evening.
Right. They're starting to fatigue.
They fatigue, or they can't talk on the phone anymore because they can't produce a voice loud enough. These are things you can monitor and say, oh wow, I can do these things now and I haven't been able to.
Yeah, it's really a simple device. I mean, it's not difficult. I'm just curious, how often does that has to be cleaned?
That's a great question. And there is a video on cleaning on that
Sure.
start page, and the written instructions are also there. Um, Clean it as needed. So don't shy away from cleaning it. You could clean it every day if you want. Do not use it unless it's dry. Don't take a big inhale of a wet
Sure.
So cleaning it after you've used it at night and letting it air dry overnight, beautiful. There are also instructions on how to disinfect it. So this breather is my son's, and he dropped it behind the couch, and that was a disinfecting time.
Sure.
So we washed it and then disinfected it and could move on. You might want to do that if you got sick and you thought, oh, okay, before I had symptoms, I probably had that. Let me go ahead and disinfect it before I reuse it again after I've started to recover.
Sure. Um, this is maybe a little bit out in left field, Betsy, but I want to ask you this because it's something I've been researching lately. Mouth breathing versus nose breathing.
Yeah,
Your thoughts? I wonder.
I
You know,
definitely have thoughts on this. At rest, when you're resting, you're not exercising activity,
sure.
you should be breathing through your nose. Um, if you breathe through your mouth at rest, um, I'm not sure which kind of health provider you should talk to, maybe an allergist or an ENT, that kind of thing. Mouth breathing, if you're exercising and you switch to breathing through your mouth, I'm not that concerned. I have had some people feel concerned that this is going to train them to mouth breathe. You're really only doing it at most 10 minutes a day.
Sure.
So if I do exercises where I lift my knees up because I'm looking to strengthen the muscles in my hips,
Right.
I don't start marching everywhere.
Right.
I
Exactly.
walk normally when I'm done with that. But if you were concerned, you could do your session and then afterwards stop and just do some nasal breathing as a reset and then go about your day. The
And
breather,
diaphragmatic nasal breathing.
yes,
Yes.
yes, for sure. I'm also going to mention the breather. We're talking about strength or endurance training, and as a therapist, I know you'll agree that's not everything. That's not the whole kit and caboodle.
Sure.
Strategies and technique is important. So yeah, focus on breathing from your diaphragm at rest during the day too. A quiet time where you're just noticing your abdomen rise as you inhale and fall again as you exhale. That's a great thing to do, nasal breathing. There are other strategies you can do in different situations.
I don't. I wonder if we just touch upon this. In a lot of neuromuscular diseases, you could have shortness of breath, and you
Mhm.
could also have difficulty speaking.
Mhm.
Um, would this help with that?
Yes, I have used this with patients and really liked the outcomes, say in Parkinson's
That's what I was
or
thinking.
essential
Right.
tremor. But really, if a person had a stroke and they have weakness, I'm looking to strengthen that. I want activation of those muscles. I want to strengthen it. I have even used it in diseases like MS or
Sure.
ALS. It's a careful approach because we're being very careful of the energy they have for the day.
Right.
But it's not just strengthening with the breather. We're also a lot of times alleviating symptoms. If you deal with mucus every day, where you're coughing up mucus every morning, the breather can help mobilize that. So you use your breather in the morning and then you watch the video on huff cough. You do the breather.
That's on the website.
Yes. Under training videos, huff cough, or just internet
HUFF.
internet search huff cough. Huff cough. Use your breather, huff cough. Now instead of coughing for 30 minutes every morning, it's all down to a 7-minute routine, and you actually have energy left over to eat breakfast. Those types of things.
Oh, fantastic. Well, I'm going to mention the website again. It's PN Medical, P as in Paul, N as in nice, medical.com. And you got to check it out because there's so many resources. And like Betsy said, don't buy a breather, just check it out once and see what you think. And you can talk to your health professional to see what their opinion is. And but it's an inexpensive way of really recovering, or at least getting to an optimal level of what you're able to perform. So, Betsy, is there anything else you want to add?
I'd say, use the website as resources, but also reach out to us if you have questions. It's why PN Medical has a clinical team, and it's always a pleasure.
Well, that's good. Do you have do they have an email that we could put under the comments here that people could reach out that way?
Yep. Care, CARE, at pnmedical.com.
Oh, nice. So care at pnmedical.com. I'll have it down below too. So, well, Betsy, we were so happy to have you here today. This is, a problem that is really quite prevalent, in many forms, and that you were able to address. And it's a fairly simple solution, not always a solution, but maybe at least a managing issue that with so many problems. So thanks again. I hope we can maybe have you on the program again sometime. We got a lot
Thanks for having me.
Thanks.